How are you? It's Dr. Pam, and thanks for tuning in to another short video with Dr. Pam, owner and founder of Academic Coaching for World Changers. You guys know how I feel about studying. I say studying is not taking test questions, but so many of our clients all day, every day say, can you please give us test questions? So I will tell you again, studying is not taking test questions. However, I'm going to use test questions to teach you content. If we understand content, if we understand how we answer test questions and then learn the content, then we'll get all questions right. Okay, so stay tuned and hang in with us for another practice session. So I say to you, invest in yourself. You are worth it. If you watch my videos or spent any time with me, you realize that I tutor mainly women. This is a field in the counseling social work field where most people are women. Women, I cannot tell you how important it is to put yourself first. You are setting legacy. You are planting seeds. You are being generative. We talk about Erickson. We're leaving a legacy for what we want our future to be like. So the goal is, if you remember to always take time for you, if you take out 90 days for studying, and do this just once, you'll never do it again. Learn that you are important and you're passing those seeds on to your children, like teaching your sons and your daughters that women are important. Take care of yourself, my ladies. Okay, so remember, when it comes to questions, there are two types of questions. There are going to be application questions, where we get a scenario, we have to apply the content of the scenario. When we have a scenario question, we're always going to follow the problem-solving method. This is what we've learned in school. This is how counselors operate. Remember, we get paid to be nosy. We assess. We ask questions all day, every day. You know, in the beginning, a client comes in and you're doing your biopsychosocial, which includes the biological, the psychological, and the social, which is their environment. You ask them all these questions, and many times a couple of weeks later, they tell you something else. Oh, by the way, did you know? There's a term on the social work exam. I've only seen it on that exam. It's called doorknob, but most people have seen it happen in practice. When you've spent 45, 55 minutes with the client, you're wrapping up and they say, oh, by the way, did I tell you I was molested when I was 3? They drop a bomb right at the end of the session. So despite all the questions you've asked him, you're always going to find something that comes up later. By the way, that answer, when there is a doorknob, at the doorknob they're leaving, you say, I'm glad that happened, or I'm sorry that happened, and remind me, we'll bring it up next session. The goal is to remember that the sessions are set by time. And I'm not going to do that to my next client. And what we need to teach our clients are boundaries. That's very common with that borderline personality. If you're not familiar with that, be sure you tune into one of our videos or sign into a live session with us. We can always explain it to you. That is our goal, understanding content. So remember, we're going to assess. We get paid to be nosy. There's a couple of things that happen that I can't assess. Many times, if it's full of feelings, if a client is boohooing, if they are crying, if they're upset, if they're angry, I have to address feelings before I can assess. If you came to a session with me, or you go into your session this week with your client and they're boohooing, you're not going to start off with, well, so let's start off with your name and your address. We don't do that. We're human. We're human. Feelings trump assessment. In a group setting, remember, I have a warm-up, I have the plan, and I have the closing session. In the warm-up, if something comes up and it's full of feelings, I'm not going to ignore it. We deal with feelings. That's our job. And of course, safety trumps everything. My safety as well as the client's safety. The Code of Ethics says I have a right to be safe as well. I have a right to be in a safe work environment. So remember, we plan with the client, never for the client. Our planning is based on our therapeutic orientation. That means if I'm a behaviorist, if I'm solution focused, if I am Carl Rogers. So the planning is the SMART goals, but the treatment plan is based on the therapeutic orientation listed in the test question. So remember, the termination starts at the beginning. My goal is to work my way out of your life, whether it's 12 sessions, whether it's 3 months, 6 months, until your insurance runs out. Either way, everybody knows when it's going to end. So those are how we work. That's how we work all day, every day in the mental health profession. Now, Bloom's taxonomy is the change that we've seen in the test. Back in the day, okay, not really back that far in the day, but in before 2019, for most exams, 2018 was a social work exam, and 2019 was a change in the NCE exam. Questions were at the recall and understand level, very basic. Freud's 4 stages, what happens in the oral stage. We don't see those anymore. If you get a recall question, those are the hardest questions. That's that one line that you get. And if I don't know the content, I'm lost. What is externalization? Give an example of externalization. If you don't know, that belongs to narrative family therapy. If that confuses you, again, you need to sign up for some sessions with us. You need to learn this verbiage. You need to learn what theorist said what. So we're going to apply and analyze now. You get a scenario, you get the one line, and you have to figure out what it means. So those are just content area. You have to know content. Remember this test, there's no correlation between you being a good test taker and you being an excellent clinician. Those two things are not remotely related. There is a correlation. A correlation means that these two things happen at the same time, not saying one caused the other. That's a research term. Correlation between passing your licensure exam and making more money. Just saying, they both go up. So we definitely want you to pass your exam. Want you to pass your exam on the first or the second time or whatever time you decide to spend with us. Stop buying material. Please, most of our clients own every piece of material out there. Stop spending money on material. Let us teach you. If you could do this by yourself, you would have done it already. Just facts. The same thing that I tell my trainer, my medical doctor, anybody else that supports me in my life. I need that support, and it's okay. So again, questions are going to be recall, which are higher level thinking now, or they're going to be application questions. We're always going to teach how we answer the questions, always the same way. Dr. Pam, if you're ever in session with myself or any of my therapists, my coaches that are also therapists, we could care less if you get the question right. That's not true. We always want you to get the question right. But what we focus on is why you got the question right. If you ever see a question on our Facebook page, which we post very often, what we want to know is how do you know it's the right answer? That's it. If you can go back to the question, especially if it's a paragraph, and prove it to me, Beck would say Socratic thinking, go back and show me. Or if it's a recall question, tell me what information you know. Prove to me that that's client-centered. What words? Prove it to me. We're always going to follow the same content. Always, always, always. We have an excellent passing rate, guys. I have been around. If you spent some time with me in individual session or subscribe to our channel, I've been around for releasing videos since 2018, even around before that, just didn't release videos. In the beginning, when I very first started, the only thing I ever wanted to do was to be the top tutor. It was never about making money, ever, ever, ever. The Bible says that the world will make room for your giftings. And I truly believe that. Walk out your giftings and the world will make room for that. So money did come along. I'm not going to pretend, but that was never the goal. I just saw a need for people to stop taking the test over and over and over again. I wanted to be known as the top tutor. You will see that we don't ever sell canned material. We don't do that. Most of you have bought every piece of material out there. Stop. Let us teach you the material that you have. Okay, anyway, so let's get back to our question. I'll always remind you, no matter what you're doing, it's a reading test. There are hints and clues in the question. It's not a guessing test. I'll remind you that if you're in especially in an individual session or a group session with us, unless you see your first name, last name, and your social security number, your phone number, all of your demographics, the test does not care what you think. Not one time. It's based on theory. Leave all of your best counseling skills at the door and learn theory. So here's my question. A 26-year-old man comes to therapy at the suggestion of his roommate. He shares that his boyfriend of 1 year has been physically abusive during arguments, but insists that he loves him and believes his boyfriend will change. He says he isn't ready to leave the relationship and wants help sorting through his feelings. The therapist should first. As always, I'm going to stay in the question. I'm going to understand the question. Okay, so one thing I know for sure, and again, we talk about stats of domestic violence, male on male physical abuse is often deadly. Men physically hurting each other is very different than women hurting each other. Either way, it's not okay. It is not acceptable ever, ever, ever to put your hands on another adult person or another child. Dr. Pam will tell you all day, every day, it's not okay to put your hands on your children, but that's another test question. So again, he's 26, he's young. His roommate says, hey, maybe you should go sit to see somebody. My client says, hey, he loves me, he loves me, he loves me, and I know he'll change. I think all of us in our personal life with our friends, our personal life being in an intimate violent relationship, intimate partner violence relationship, IPV, used to be domestic violence, now it's called intimate partner violence, right? We know somebody, it's very close to home. So at this point, he doesn't want to leave. Okay, what do I do first? He didn't come to me asking for help to leave. Let's clarify the question. He didn't say, I'm trying to get out. What he said is, I'm trying to sort through my feelings. That matters in this question. So let's look at our 4 choices. Okay, so again, based on what I'm looking at, this is my question. I'm always going to remind you, every question measures a KSA, a knowledge, skill, or ability. This one is measuring a code of ethics. The code of ethics says that I can't report this. I know, right? So many of you want to report it because we think, oh my goodness, let me call in. I cannot report this. If 2 adults are engaged in a domestic violence relationship, if an adult person tells me when I go home tonight, he's going to hurt me or she's going to hurt me, don't go home. I cannot report that. I can assist them in reporting it and I can support them, but that is part of confidentiality. So imminent danger, right? If you know you're in imminent danger, don't go home. But if you choose to go home, that's an adult choice. So the client has the right to make their own choice, and I cannot report that. As hard as that is, and as painful as it is, I cannot report that. Let's look at our choices. Our first one says, provide him with resources for domestic violence shelters. Our second one says, acknowledge his ambivalence and support his autonomy. C says, confront him about the dangers of staying in the relationship. And D says, educate him about the dynamics of abusive relationships. Okay, so this is a question. These are all 4 of my answers. Many of you will pick an answer and you'll just walk away and swear up and down you got it right. If that's what you want to do, please stop the video and you can come back and you can see the answer at the end. If you want to work through it with us, just keep listening. So I'm always going to talk about the importance of the content behind the question. I could care less if you get it right or not. What I do know about the code of ethics is it says client self-determination. Clients have the right to make their own choice. Client self-determination refers to the ethical principle that clients have the right to make their own choices and decisions regarding their treatment and their life goals, with counselors or social workers acting as guides and supporters rather than dictating their paths. Especially, it means respecting a client's autonomy to decide what is best for them in the client's life and in the therapeutic process. For my new people, my new clinicians, and I teach college, this is the hardest thing to learn. I've been around, I've been doing this for 30 plus years, guys. It is the hardest thing to know. I know the cycle of violence. I know what's going to happen. I know. I've been around. I know. I've got friends, girlfriends, and guy friends that are in these relationships. I know what the stats say. However, why do I think my clients don't know that? Is that my job to educate them first? I think everybody knows those stats. My clients, my friends, anybody in my life needs support. I'm aware of what it says. Now, if you live in a state that the state says that you have to report, that is a state or jurisdictional issue. We all take the same test. Now, many people have a laws test in your area, in your state. I'm from South Florida. In South Florida, there's a jurisprudence test. I always put it out there. I failed the first time. There were 10 questions and I failed the first time. I passed the clinical exam first time, but not the law exam. However, laws are based on your state. The exam is based on ethics that everybody takes. So you cannot bring your state into this question ever, ever, ever. If you see a question that ever says follow the local and jurisdictional laws of the area or follow the laws in your state, that's always the right answer. That's a question that's really determining specifically about the state. But unless the question says that, the assumption is we're talking about ethics. Okay. Ethics are why we will lose our license. Ethics is that I will follow the code of ethics. If you ask me, if you've been any time with me, Dr. Pam says all day, every day, the most important thing is to be ethical. Do what the code of ethics says. My feelings, my thoughts have no place in the code of ethics, no place with my client. Nowhere does it say, this is what I think is best. It's not my life. I don't get the right to make that choice for anybody. I value, one of my total values is education. I understand as a first generation college graduate, as raising my children, as being a doctor, I understand that education changes your life. I so value that. And when a client says to me that they want to drop out of school at 16, or as a former school social worker, I had parents who said they would sign their kid out of school at 16, my heart cringes. But that's not my job. My job is to support my client. So let's always, always make sure that we remember our feelings, our values have no place with our clients. So let's talk more about domestic violence. So the cycle of violence is by Lenore Walker. And guys, I'll be very honest with you. I really thought she was a Black woman in the beginning. Not gonna lie. Okay. She's not, and she's been around for a very long time. So what we know is there are 3 phases. So most often there is the tension phase. I know it's going to happen, right? I feel it happening. I'm walking on eggshells. I'm trying to make sure everything is perfect. I'm wondering about what's going to happen. I'm waiting for it to happen. One of the things that we teach clients who are going to stay in that relationship, and for your friends as well, ladies and gentlemen that are going to stay, that's where we talk about a safety plan. One of the things that we teach, and I teach this in my class with my students, is if I feel the tension building, I'm going to stay away from the kitchen and the bathroom. Lots of reasons, right? The kitchen and the bathroom usually have a tile or hard floor. There are sharp corners. Of course, the kitchen has knives and lots of other things that can definitely make it much worse. I'm going to try to guide the abuse to the bedroom, the softer places. Okay, that's part of a safety plan. One of the things that we teach women back in the day, again, clients in general, but one of the things that we teach is to plan to leave. When we first started teaching about domestic violence, we used to teach clients just to leave. Just leave whenever you can. Just leave, just leave, just leave. We don't teach that anymore because we know research says that is the most dangerous time. When I plan to leave, I need to have a safety plan, because if not, I'm going to get killed. Okay. So the goal is plan the plan. So if that means saving up money, if that means hiding birth certificates, child's clothing, getting separate copies of Social Security cards and hide them someplace, that's part of the plan. One of the things we also teach is keeping your keys in the car. Right. So if you know you have to leave, and that's one that I use now, and I live by myself, so no domestic violence here, but definitely having your keys in your car. Should there be an environment, my car's in the garage, by the way, not on the street. Should there be some kind of reason I need to leave my house quickly, I don't need to look for my keys. I know where they're at. In real practice, I had a client once who told me that she would buy, he would give her so much amount of money for groceries. He'd look at the receipt when she came back to make sure that's what she spent. And she would keep the receipt and she would take things back. She would buy the expensive bread, the expensive cereal, things like that. And she would take it back and hope that he didn't notice. And she kept saving money slowly. Okay. So in the tension phase, if I know I'm going to stay, I'm going to make sure that that's when I'm building my safety plan. So what happens is now it erupts. So the tension builds and then the incident happens. He beats me, he kills me. I'm sorry, he beats me, he threatens the children, he whatever he does, all of that, or she does. So it blows up. It's the threats, the destruction. You feel for you or your child's safety. And of course, many times the drug and alcohol abuse. We know that domestic violence goes up during the Super Bowl's coming up. I'm recording this one in January of 2025. And the Super Bowl, there's an increase of domestic violence, which is definitely related to the amount of drug and alcohol use. And then it's over. That's the honeymoon phase. And they apologize. I'm very sorry. I'm sure I didn't mean to hurt you. What we know is it's 7 to 12 times before they actually leave for good. Many times they'll leave, they'll go to a shelter, and then end up going back home. Okay. So again, I said before, Lenore Walker, she is the author of this theory. So over a period of time, there may be changes to the cycle. The honeymoon phases become shorter and the tension and the violence may increase. Some victims report they never experience an apology or a loving abuser, but simply see a decrease in tension before the start of a new cycle. So what happens, and there's a test question sometimes, it happened a year ago, and he says it'll never happen again. That's not true. Based on what we know with the research and what your mom and them said, that's a African-American colloquialism, your family, the people have told you, it'll happen again. If it happens once, it'll happen again. Okay. So as the cycle begins, the victim starts going in and out of the relationship. They often make many attempts to make a final decision to leave for good. Feelings of guilt, insecurity, and concern for children's well-being play a strong role in the victim's decision-making process. We know this happens across all stratification areas, all social, economic demographics, whether I'm very wealthy or very poor. I've worked with everyone in all of those demographics that still stay in relationships. If I went up with you on the first date and you hit me on the first date, would I stay? Of course not. What we know is there's a whole plan before someone actually puts their hands on you. So what happens in the beginning is we start dating, right? And you're, oh my gosh, you're great. You think I'm so wonderful. And then you start buying me clothes. Oh, you look great in this. You look great in this. I think you should do this. So if I've never had that much attention, if I grew up in a home where nobody fed that inner child, I'm thrilled. Somebody cares about what I look like. Somebody cares about what I'm wearing. I am thrilled. It escalates. Then, I want to know where you're at all times. I want you to keep your location on your phone. I worry about you. I want to know where you're at. Again, for our people that have never had that in the parent relationship, it feels so good that someone cares about me. And how that eventually continues is then, I don't want anyone to be with you but me. Don't spend any time with anybody but me. So that leads to the isolation. As that isolation continues, this person who loves me so much and tells me that how in the beginning how wonderful I was, now begins to tell me how worthless I am, that nobody would love me but them, that I'm a piece of crap, I'm not smart enough, I'm not good enough. All of these things happen before anybody puts their hands on me. That's what it looks like of how we get there. Okay. So what we know when people decide to leave a relationship, this is always the right answer for the test. I've had enough. The bad begins to outweigh the good. That theory is called the social exchange theory. So what it means, and all of us, not just for domestic violence relationships, but all of us in any relationship, whether it's a job, whether it is a friendship, I'll stay as long as I'm getting more out of it than I'm putting in. Normal human relationships, that's what I do. It's good for me. I'll stay. When it begins to flip and it costs me more than I'm gaining, I'm going to leave. So in a domestic violence relationship or intimate partner violence relationship, I'll stay because you know what? He's paying my bills. He's taking care of the kids. He's doing all these wonderful things. I'll stay. But when it flips, when I'm at danger of losing my kids, when I'm in danger of losing my life, that's when I'll decide to leave. When it flips, that's called the social exchange theory. It refers to the framework that analyzes all human interactions and the relationship as a cost-benefit analysis. Again, when it costs me too much, I'm going to leave. Okay. So again, that's the right answer for for when I leave a relationship, but it's also the answer. It's a theory for all humans. And this is always going to be most often one of the theories on the test that you need to know. So let's go back to our question. Okay. So I have a question. A 26-year-old man comes to therapy at the suggestion of his roommate. He shares that the boyfriend of 1 year has been physically abusive in arguments, but insists he loves him and wants his boyfriend to change. He says he isn't ready to leave the relationship and wants to sort through his feelings. I'm going to hone in on that. He's not ready. He says to me clearly, I'm not ready. Let's look at my 4 options. And of course, we're always going to rule out 2. If you have a test that has 3 questions, I'm going to at least rule out 1. If I can rule out, it makes it easier to get to my answer. So I said, provide him with the resources for domestic violence shelters. B, acknowledge his ambivalence and support his autonomy. C, confront him about the dangers of staying in the relationship. And D, educate him about the dynamics of abusive relationships. So let's go. I said in the beginning, we assess, right? We get paid to be nosy. I don't see anything in these 4 choices that I can ask any more questions. I don't see that as an option. However, feelings are really high in this question. He wants help sorting out his feelings. So if the question is high in feelings, my answer has to talk about feelings. Okay. So provide him resources for shelters. He said to me, he doesn't want to leave. I'm trusting the question. I'm not adding anything or taking away anything. He said, I don't want to leave. A is out. B, acknowledges ambivalence and support his autonomy. I'm going to keep B in. D, confront him about the dangers of staying in the relationship. So we do confront, we do. Counselors, social workers do confront. However, this is not a time for confrontation. When the test question talks about when my mouth and my body don't line up, when it's incongruent, that's when I confront. If the client says, oh, yes, I'm going to leave him, and he comes back next week and says he didn't leave him yet, that's when I get to confront. So I'm looking for incongruence in the mouth and the body. It doesn't match. What's coming out of my mouth doesn't match my body. And if you've seen my videos, I'll say, Shakira says, hips don't lie. We always believe the body, not the mouth. and educate him about the dynamics of abusive relationships. So the two I'm taking out are definitely going to be A and C. Okay. I'm going to B or D. Now, when I get down to the two, this is where we all get stuck. Okay, what do I do? What do I do? Most of my clients spend so much time between B and D, but don't go back to the question and forget the rules of how you answer a standardized test, which is based on the question. Okay, so acknowledge his ambivalence and support his autonomy, or educate him about the dynamics of an abusive relationship. What would I do first? He came to me and he wants help sorting out his feelings. My answer, of course, is acknowledge his ambivalence. Ambivalence is, I'm not sure what I want to do. I love him. So that's his feelings. And I'm supporting his autonomy because the code of ethics says he has the right to make his own decisions. And he clearly said in the question, he didn't want to leave. Right. So no matter what I think, no matter what I know as a counselor and what I know is going to happen in the future or my belief system, I don't have the right to tell a client what to do with their life. The first step always, and remember, the most important thing with any client is always a therapeutic alliance. The only orientations that don't talk about that would be Freud and also my behaviorist. Everybody else says, every other theory says the most important thing is the relationship between me and my client. I trust him, he trusts me. Okay, so I can be an expert gestalt. I can know everything about the unfinished business, the empty chair technique, all those things. But if my client and I don't have a rapport, it won't matter. The first step in a therapeutic alliance is meeting with the client where they are emotionally and validating their autonomy. Clients have the right to make their own decision. Acknowledging his ambivalence and supporting his right to make a decision, the therapist creates a safe and non-judgmental space. The approach is respects the client's agency and builds trust, which is essential for further exploration of this situation. All of these other things I can do later, right? But first, let's build that therapeutic relationship. Guys, I hope that it shows that we enjoy what we do, that we always want to make sure that you are learning content. We want you to pass this test the only time you spend with us. Stop buying materials. Stop spending money on materials. Stop taking test questions. Understand and learn content. The best way to do that is to schedule a couple sessions with us. We are the experts in content. We're the experts in mental health tutoring. We're the very few unique companies that only teaches tutoring to mental health people on how to pass a professional licensure tests. You can find us on our website, of course, and find our prices and all of our upcoming dates. Please subscribe if you're watching this video today. Subscribe. We release them all the time. And of course, if you want to schedule a session, you can always do it on our website, but always just reach out to my staff, drpam2020@gmail.com. I know that you can change the world, and I hope I see you in a live session with me very soon. Thank you.